Hello again, everyone. Welcome back to The Honest Nurse. We have a lot of things to talk about today, really important stuff. Many of you are aware that there is a movement nationwide by state boards of nursing to implement implicit bias training into continuing education programs. Now, I want to be clear here, this is not just suggested content or recommended content or content that is offered as an acceptable choice. This content must be completed as a requirement to license or relicense your nursing credential. That means it's mandated. So if this is not completed, you will not have a nursing license and therefore cannot work as a nurse. Now, any mandate is handed down by an administrative organization defined as an official order to do something. In this case, the Kentucky Board of Nursing. Now let's think long and hard about mandates. Okay, what else in our lives as nursing professionals has been mandated over the past couple of years? And if you didn't do it, you lost your ability to work. You guys know where I'm going with this, right? Now, in recent years, implicit bias has become a new buzz phrase in the media, a politically popular phrase to address the perception of inequity. There are tons of articles out there about it, and it's a heavy topic, as I said, so I apologize if this gets really deep and complicated. This will likely be a two-part video, and I'm not here today to convince you one way or another about it. Okay, I just want to discuss the facts surrounding it. Now, through the years in my state, we have taken required continuing education courses in HIV/AIDS, also domestic violence, shaken baby syndrome, and preventing nurse suicide. Now, each one of those topics was objectively documented, reflected evolving health concerns, and was therefore relevant in nursing practice. So along comes the need then, or the perceived need, for implicit bias training. Now, I've been a practicing nurse for nearly 40 years now, and have never heard of this epidemic of implicit bias until the last 2 years. I wonder why. So I thought it might be a good idea to take an in-depth look at this. Now, the topics of ethics training and cultural competency were addressed for all of us in basic Nursing 101 courses. We're taught to adhere to best practices in nursing, to establish therapeutic relationships with patients, to provide patient-centered care that addresses each patient's unique care needs, and to be aware of cultural differences with patients that can affect their care, whether it be because of their race, ethnicity, religion, sexual orientation, gender, socioeconomic status, disability, or diagnosis. I know I learned that in nursing school, and I'm sure all of the rest of you did too. Now, on a personal note, give me a chance here to go down this rabbit hole. I've discussed this topic with many of my colleagues, and most of which have been practicing nurses for many years. Now, what does it say about the need for this kind of training to a professional who has spent their entire career practicing without bias? I can tell you it is damn offensive. To have worked your whole life in a way that honors each patient's unique presentation, and then to be told that you haven't been doing it right all this time. You weren't doing enough. You weren't doing it right enough, good enough. You just weren't doing enough. Oh, you better believe that's pretty offensive to a career nurse. Back on track we go. Now let's talk about continuing education. According to the Kentucky Board of Nursing website, this is a quote, "The purpose of mandatory continuing education is to require evidence of the nurse's efforts to update his or her knowledge of nursing science and to maintain or to develop new skills. Okay, so I have a few questions about that. First, is implicit bias a proven nursing science topic? Now, the reason that I ask this question is because in my research, for every argument that says implicit bias absolutely exists, there is another article to debunk the whole theory. The other thing about science is that it should be reproducible, it should be concrete in terms, it should be measurable in its effect, and factually based. So again, I ask, just for thought, is implicit bias a proven nursing science topic? So let's look at what actually defines implicit bias. And it's a nebulous term at best. Now again, you can find tons of definitions out there, but basically it is a form of bias that occurs automatically and unintentionally, that affects your judgments, your decisions, and behaviors. I'm not a neuroscientist, but I do know that at a very basic level, there is a portion of our brains that take our experiences and use that information to organize the world. And we create associations to make predictions about life. Now that sounds pretty heady, you know, no pun intended, really. So let's just take a real life example. Let's just say you're standing in the middle of the street and a car is coming at you. Now we don't think about how fast the car is coming, what color the car is, what type of car it is, are the wheels inflated or flat, or if it's going to stop, we just get out of the way. Another example, we know fire is hot. This is pretty basic. I don't need to stick my finger in the fire to know that each and every time fire is going to be hot. I've organized my experiences with fire to create a stereotype in my brain about how to handle fire. So what does implicit bias actually look like in the course of a nurse's actions? I'm not sure. Not answering the call light fast enough for an 80-year-old dementia patient at the end of the hall? Maybe being late with a pain med for a drug-addicted patient? Not being able to speak Spanish to a patient from Mexico? I really don't know. But what I do know is that at the beginning of each shift, a nurse has a designated workload to accomplish during his or her shift. The nurse has to prioritize care and give that care in a way that is timely and appropriate. She has to determine what is most important at what time. And maybe it takes longer to take care of one type of patient than another. Does that mean that he or she has a bias toward the other patients in his or her care? No, it doesn't. But it's curious to me that since 2019, the studies based on looking at nurses' behavior with regard to these factors are difficult to find. Now that's key. They're difficult to find, yet we somehow know that they have implicit bias. Something to think about. Now, one popular tool to measure implicit bias and increase awareness of this phenomenon is the IAT. It's called the Implicit Association Test. So here's the thing about the IAT. It's a platform of online questions that you take to assess your personally held stereotypes. Now, it's been out since 1998, developed by social psychologists. Pause for effect. Now let's remember, social sciences cannot produce measurable results, but we are told to believe it's real. However, here's the rub. The test itself has come under fire for not being reliable, not being valid, and not being useful. You can easily take it one day and get a certain score, and a few weeks later, take it again for a completely different score. So, you're probably not surprised to hear that we just do not have the evidence that implicit bias training actually works. These training programs are multiplying throughout the workplace. In Google, Facebook, the US government, many corporations are implementing implicit bias training, but very few rigorous evaluations of these programs exist. None of these interventions have been shown to result in permanent, long-term reductions of implicit bias scores on the IAT, if you believe that, or more importantly, meaningful changes in behavior. Okay, so here we are. Let's sum it up. Regardless of who we are expected to accept the assumption that each of us has a problem with implicit bias. Number 2, just remember, there are just as many articles that say it is real as say it's false. Number 3, we do have a test, supposedly, to test for implicit bias, but that's not reliable. Yet, we all need training to address this epidemic of implicit bias. This just doesn't add up for me. It sounds like there's a very different agenda at work here. And we will look at that in depth on the next video of The Honest Nurse. And at that time, we're going to look at a few things. First of all, we'll look at the constitutionality of this nursing mandate, because remember, before we became nurses, we are US citizens, American nationals, people who are protected by the US Constitution. Before you were a nurse, you were a citizen protected by the Constitution, and you do not check those rights at the door when you push the time clock. Second thing we'll look at is why now? Why now, after all this time, is this requirement being forced down our throats? Is it coincidental for some other reason? We'll take a look at that. We also want to take a look at the role of higher education in nursing, who has somehow felt empowered to hand down mandates from above. Stay tuned, and remember, here at The Honest Nurse, if you don't stand for something, you'll fall for anything. Take good care, everyone, and please like and subscribe. Bye now.